Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, I want to talk about my favorite subject, and that is caring and sharing, because we should be caring about each other and sharing our med moments. And you all know what I mean by a med moment. That time when you have that abdominal pain or that stomach pain or that chest pain and you just can't figure out why it's happening. That's the moment you should see your doctor. That's a med moment. And we should share those with others so that they would have the opportunity and have the will to go and see their doctor as well. Because sometimes, we're afraid to go see the doctor, but we shouldn't be. Because preventive medicine it's all about being preventive. We should be educated healthcare consumers. Remember that. All righty. Hey, listen, look me up on the web. It's obeyyourdoctor.com. We have so many health tips on there. You got to look it up. We have links that go to other areas that can give you more information about medicine and about as far as different diseases are concerned. So look at that. We're on the web, we're on Facebook, we're on Twitter and Instagram. So look us up. Any one of those mediums you can find us. All right, let's talk. Let's talk about dieting today. I want everybody out there to lose weight because you understand, if we just think about this for a second. If we lost 10% of our body weight, if we're overweight, then that would decrease heart disease, it would decrease diabetes, it would decrease hypertension, kidney disease, all of those would come down. So let's all get together, let's help each other lose weight. So what I'm going to give you is a few tips. Try this. Don't skip meals, because if you skip a meal, guess what? The next meal is just going to be twice as large. You're going to make up for that you didn't take in the first meal, all right? Take a walk before or after you eat. That's very important. That revs up your metabolic rate, or how fast you burn your calories. And guess what? If you rev up, then you burn more calories and you're going to lose weight, all right? Always eat the most filling thing first. So you fill up first so you're not nibbling later, all right? Never reward yourself with food. That's a bad policy. You're guaranteed to gain weight with that. Take time to eat, all right? And eat properly. Just take your time and chew your food. All right, enjoy your food. That's important as well. And if you're going shopping, never go shopping hungry. Bad. That is just the worst thing. You'll be putting everything in the cart. So those are some tips as far as trying to lose weight. I hope everybody out there is on a diet, and we all need to huddle together. Let's get this done. All right. We have a show tonight that we're going to talk about pacemakers. And pacemakers deal with the heart. And the heart, sometimes it doesn't, the beat is just a little off. And well, maybe it's off because you fell in love and now you're out of love. But we're not talking about that kind of heartbeat. We're talking about the regular heartbeat. And I have the perfect person to talk about this particular topic. His name is Dr. Lawrence Mahdi, and he's an interventional cardiologist. He's at Newark Beth Israel Medical Center. Dr. Mahdi, welcome to our show.
Omar, thank you. Thanks for having me again.
All righty. So let me tell you, this is such an important topic because I have so many of my patients that have pacemakers. We really need to talk about these. Absolutely. So first thing I would like to know is, what is a pacemaker?
Sure. So before we get to that topic, we'll talk about the normal structure of the heart and how it is that we end up needing an artificial pacemaker. Mm-hmm. So if this is a cardiac model, and it is important to know that every human heart has special cells called pacemaker cells, for lack of a better word.
Okay.
And these pacemaker cells are special cells that actually create impulses, signals, that they travel to the heart from different chambers of the heart, from one chamber to another, through special fibers. It happens that just like in our house, where our fuse box in a special location, either in the basement or outside, in our hearts, the special pacemaker usually is in the upper right chamber, in a special place, most of us in the same spot, and from that spot, through fibers, electrical impulses are sent to the heart, so the heart can contract and work efficiently.
Right.
Sometimes, for a variety of reasons, Those reasons can be a heart attack, a damaged heart from a virus, sometimes medications, sometimes one of your specialty conditions, sleep apnea.
Right.
Sometimes when people take medication that are essential for blood pressure and does a great job, but still it could slow down the heart rate, for some reason the heart slows down.
Right.
It is the job of the physician and the cardiologist to determine, are these slowing down heartbeats something in a temporary fashion or permanent fashion. Hopefully it's temporary and the doctor can make the right adjustments and the problem resolves. If the decision is made that it's permanent, that's where the topic of an artificial pacemaker comes in and the decision is carried out.
Okay, so let's just step back just a minute because you said a lot. And we're just going to go. Now, the pacemaker, the heart has a special area, and there's a special area in the heart that sends signals all the time to let the chambers know to beat.
Yes.
Alrighty, and those are those special cells that you were talking about.
Exactly.
Now, what allows the signal to go from one chamber to another, or from that special cells down? What happens? Are there tracks, or is there, how does it go around? How does it get around the heart?
So the impulse starts in the upper right corner. The technical term is synatrial node or SA node, and through very small fibers within the muscle of the heart, within the chambers of the heart, it goes from the upper chamber to a small sort of stop sign in the middle, and then to the lower chambers.
Right.
And it helps the lower chambers, as we know there are two lower chambers, two upper chambers, and it helps the lower chambers to contract or to squeeze together at the same time,
Right.
so the blood can leave the heart and send in oxygen to the rest of the body.
Oh, interesting, interesting. Now, once that pacemaker area in the heart, that's those cells, once it's not working properly, meaning that it's not sending the right signals. For some reason, those fibers aren't catching and the chambers aren't beating right, or going too fast or going too slow. Is that when you need to put a pacemaker in?
Correct. The fibers of the special pacemaker of the heart has a special range. We all want to say, oh, what's a normal heartbeat? Well, a normal heartbeat in the book is always 60 or 100.
Right.
It doesn't mean that if it's 59 we're in trouble. It doesn't mean if it's 101 we're in trouble. The symptoms play a big role. How do we feel? You go see a doctor, your heart rate's a little bit low. You feel great. Yeah, okay, I'm making a little adjustment to avoid any future problems. But some people really feel bad. One of the symptoms of dangerous slow heart rates are fatigue, dizziness. People who keep passing out for unknown reasons. People who are sluggish, people who have chest pains or short of breath, they just can't function, forgetfulness. There's so many things that could be explained by slow heart rates, and I mean dangerous slow heart rates. I should also ask that one of the conditions is, even though it's rare but very serious, some people are actually born with very, very slow heart rate. It's congenital, and at some point in their life, they may require a pacemaker. But that is not too common. It's another form of why people require pacemakers.
Right.
So following up, determining the cause of the heart rate is important. Is it temporary? Is it permanent? If it's permanent, what needs to be done? And usually that's when discussion of the pacemaker gets started.
That's when you start. Now, how do people usually present to your office? And boy, I think this guy may need a pacemaker. What's the typical presentation?
Typical presentation, dizziness. I passed out and I came to. Some people unfortunately pass out and stay unconscious. That's pretty serious. Those require more urgent attention. But for people who are not that critical, people just sluggish, dizziness, they pass out, they're short of breath, they're tired, they sleep a lot, they don't have energy to do things. Sometimes the low heart rate makes the blood pressure become low because the heartbeat and the blood pressure, they work together. That's one of those signs. And so those are the clues that, listen, there's a problem, we got to investigate and solve the problem.
I just want to say ask one thing. Now, because the heart is pumping so slow, does that mean you pass out because you're not getting blood to the brain, or is it you're feeling sluggish because the blood is not going around your body appropriately? Is that why you feel sluggish?
Exactly. The blood doesn't circulate to your brain, oxygen doesn't get there, and because the heart rate is low, therefore the blood pressure also drops. It's a combination of low blood pressure, which leads into less blood flow, less perfusion, which is flow, and as there's less perfusion, there's oxygen. So all these together lead into a patient not feeling well, feeling sluggish, dizzy, passing out, not waking up easily, always want to rest, they have no energy. It's a variety of things. Sometimes it leads to chest pains or short of breath, they can't function properly. So once the decision of the pacemaker is made and is made in conjunction with a cardiologist, then we decide what type, what's best for you, what's best for the person. Because the heart has the upper chambers and the lower chambers, some people just need the pacemaker for a lower chamber.
Okay.
Where it means the electrical signals are fine in the upper chamber, but when they get to the lower chamber, they don't contract well. So it's a decision is made by the person who puts in the pacemaker, and some people need both the upper and lower chamber worked on. So that's where the terms single chamber versus double chamber or dual chamber pacemaker comes in.
Okay, let me try to understand that, what you just said. Now, what you're saying is I put a or you would put a pacemaker in, or somebody would put a pacemaker in, and there are different types of pacemakers.
Yes.
And the one type of pacemaker, maybe the upper chambers are being stimulated appropriately. It's contracting, they're doing their thing. The lower chamber is not receiving it, so the pacemaker would have to go into the lower chamber and hit it with a little stimulus so that it'll contract.
Exactly.
So and then sometimes you need both of them. Some patients both of their chambers, the upper chamber and the lower chamber, may not be working appropriately. So it may need a wire going to upper chamber and one to the lower chamber, and then the pacemaker will decide how to contract each of them.
Exactly. Right.
Excellent, excellent. These things are pretty good. I like these things. Go ahead.
The pacemaker is, think of as a little computer, as a little built-in computer.
Right.
Has a sensor in it. It senses things, it detects things. So some people's problems are serious, but they don't need to have the pacemaker functioning every second.
Right.
So sometimes the problem that people have is transient. It's very serious when it comes. When it doesn't come,
transient.
Comes and goes.
Comes and goes. I like that.
So when it comes, it's very bad. And at that time, the pacemaker kicks in or starts working. And when it doesn't come and your own heartbeat takes over, the pacemaker says, you know what? I'm going to sit back. I'm going to watch you just in case it happens again. But meanwhile, I'm not going to conduct any artificial signals. You're on your own. But it keeps watching you. So it has a sensing capability that when you get in trouble to help you, also can sense that when you're not in trouble to leave you alone.
To leave you alone.
Right.
So it's smart, but it's like a smartphone.
Exactly.
It knows when to jump in there and help you out.
Absolutely, absolutely. So if it doesn't have to work all the time, it saves on the battery, it saves on how long they last, which we'll get into in a minute. So pacemaker is usually implanted or put into the body through a small incision, usually on the left side. The incisions are very small. Of course, you need a little bit of anesthesia to make sure the pain is not unbearable.
Right.
After the small incision is made, through that small incision, first we put in something called leads. So what are leads? So this pacemaker, which
one do you want? This one's good. I want to show you a pacemaker out there. This is what a pacemaker looks like. How about that? All right, there we go, right there. That's pretty cool. I like that. Tell me about
different shapes and forms. Now we even have smaller.
All right, smaller ones, huh? See, if I wanted one, I would want one of these small ones. You know what I mean? One of these hold on, let me get it right here for you so you can see it. There you go. I would want one of these small ones here. All right, just to give you an idea. Go ahead.
Right. So for these pacemakers to communicate with the heart, they have to be connected to a special wire. We call these wires leads. Okay. So leads are very gentle. Very flexible material. You can see how flexible they are.
Okay.
And they're gently threaded or placed or passed into the veins that are under our skin. These veins actually lead into different chambers of the heart.
Oh boy, so this actually goes into a vein and you track it down to the heart.
To the different chambers of the heart.
Wow.
Whether the upper chamber, the lower chamber, or both. The tip of the wire right near your left hand.
Go ahead, show me where it is.
The tip right near your left hand.
All right, this one here.
Usually with little hooks or screws, very small hooks or screws, gets stuck to the heart so it doesn't get moved.
Wait a minute. You didn't say that, did you? You're going to put a hook or a screw in my heart.
Very small, very small.
I don't care how small it is, man. No, I'm just kidding. I'm just kidding.
It's the tip of the wire. The heart doesn't.
This one right here.
Very small. It's sort of, you have to see it under the camera.
Right.
So the heart sort of grabs it and becomes part of the heart.
Yeah.
So they're very flexible. So the heart, as the heart moves, they move. And once it's the part of the wire by your left hand is put to the heart, this side of the wire is hooked onto the battery, which is the pacemaker.
All right.
So one side.
Let me take that for a second, and it's hooked to the. Which side is hooked to the pacemaker? Show me again.
The pink side.
This one
the
here.
Pink side.
Okay, so this side right here. Let me put it in front of the camera. Okay, can we zoom in on that again? Is it possible? Okay, all righty. Oh, I'm sorry. Yeah, so we don't have it zoomed, but that's all right. Go ahead, Larry, explain.
The leads are connected to the top of the pacemaker, and then it can receive the signals. It receives a signal that says, now I'm going to give you a signal because the patient's heartbeat is too slow, so I'm going to beat for you.
All right.
And then when if the patient's heartbeat gets better, it stops beating for the patient.
Right.
Some people actually, his heartbeat is always abnormal. The pacemaker has to function all the time due to a very serious condition. But most people, the problem comes and goes, and it's temporary.
My goodness, that is so interesting. I'm so glad you brought these in because even though I'm a physician, I don't see these all the time. And these are so interesting. So they are implanted under the skin and they stay there.
They stay there.
All right. Now, how long do they have to, how long does the battery last?
So the battery lasts depending on how much the pacemaker is used.
Okay.
For those who require the pacemaker to kick in all the time, and the patient's heartbeat is not that reliable, of course the battery gets depleted or gets weaker much faster.
Right.
And the average, and this is very debatable depending on the person, between 5 to 10 years, 6 to 10 years. But the good thing is that we don't have to guess, because once the pacemaker is put in, the patient's doctor follows the pacemaker so reliably and regularly that just in case that battery ends up becoming weaker sooner than it's supposed to, the doctor can pick it up and very in appropriate time and in safe time they can replace it.
So they actually had to go back to surgery though a little bit.
Minor surgery.
And do they take the whole thing out, or can you leave this one in and put a battery in it?
Right. Usually the wires or the leads stay in if they're not damaged or broken.
Right.
And they just change the
They get a whole new pacemaker box.
Battery, right.
Oh, okay. All righty. Excellent. What about as far as after you've had the surgery and the pacemaker's in, how long do you have to stay in the hospital for these? How long are you incapacitated?
So generally these days could be done. They're mostly done in a same day capacity, same day surgery. Most of the patients, unless there's an issue.
Right.
The biggest problem is the incision. There's a skin incision. It heals quickly, but of course it's painful. Instructions are given such as maybe don't drive for a while because you have to move your arms, so avoid that. Let's get driven. Don't raise your arm above a certain level, so you don't pull the pacemaker out of where it should be.
Right.
Sometimes if you don't get a chance for the pacemaker to get stuck to the heart, they pop out, and then they have to go back in and put it back in.
Rehook it.
And that's the purpose of the small screws and the hook, so they don't pop out easily.
Okay, I got you. Describe a few things for me. Okay, I know that we know that the heart has abnormal rhythms. What's an EKG?
So EKG is a machine that connects through 12 different connecting points to the chest wall that looks at the heart from different angles to record a few things. It records the heartbeat. Okay. Then it tells us is the heartbeat regular or not regular. Okay. It tells us if there's lack of blood flow to the heart. Oh. It also can tell us if you're having, and most of the time it can tell us if you're having a heart attack. Not every time, but most of the time. All right. If you have had previous heart attacks, if you have inflammation into the heart,
like swelling around the heart, the heart,
exactly,
something like that. Yeah.
So that's what the EKG does. It's a recording of the heartbeat done through a machine by connecting wires to the heart.
Okay. So that would also tell us if the heart rate is too slow or too fast, that it needs a pacemaker too, right?
Exactly. It's one of the first tools that if you come to the doctor's office or an emergency room, it's used and it can determine the heart rate and the type of the heart rate. Sometimes the heart rate, it may not be too slow, but the type of the heart rate it is very abnormal. It's not coming sequentially. The upper chambers and the lower chambers don't talk to each other. Right. It's not in sync. So that also can be something of concern.
You know, these pacemakers, they do such a wonderful job. I mean, they can sync up the chambers. They can make them go faster. They can make them go slower. I'm just amazed at what they can do now in medicine.
Absolutely.
And it extends life. This really allows people to live longer,
absolutely,
right?
Absolutely. For those who really have a slow heart rate, that will lead them to pass out and lead into maybe break their legs and and have problems. Sometimes people fall down and they break a hip. They come and realize, oh, wow, the heart rate is so low. Maybe that's why they fell. And it's important. A small caveat, a small little side note. These days, technology is so advanced, and this is a different discussion for another date, but there's something called the defibrillator. Those have a backup pacemaker. That's a different discussion, but this doesn't apply to that.
Okay.
So this is purely a pacemaker just for the slow heart rate. Sometimes the heart gets crazy. Sometimes it goes fast.
Okay.
That requires medication. But sometimes it goes slow, and that requires
a pacemaker.
Pacemaker if the physician decides it.
Okay, I understand now. Now, let's step back just for a minute and give people just some basic understanding. Is this most common in older people? Do you ever put pacemakers in young people?
As I said, some people are born with very abnormal heartbeats. That's rare, but it can be. Some people at the young age, due to either having a very weak heart or maybe a special kind of heart attack from a variety of reasons, can get that. But usually it's seen in the elderly. In the elderly,
huh? So it's just that as we get older, just like everything else, our heart gets tired.
The electrical fibers get scarred down. They get older. They get weaker. They don't function well. They get lazy, and they need help.
Okay, all right. Risk factors. Is there anything that I cannot do? Just cut it out now so I don't have to have one of these later.
So this is one of the few things that is hard to determine, and there's no specific risk factor.
Right.
So, but indirectly, if we do things to prevent a heart attack and stay healthy, therefore then that heart attack will not cause our heart rate to slow down, because some heart attacks will affect our heart rate. So that's important in terms of prevention. Generally, blood pressure by itself doesn't affect the heartbeat. Generally, it's the medication that's given for treatment of blood pressure that can affect the heartbeat.
Right.
There are viruses that can affect the heart, and they some infection of the heart can actually slow down the heart rate. Generally temporary, but it could also be permanent.
Right, right. You mentioned heart attack, and I don't want to change the subject, but just give me a few words. What is a heart attack? Because you know what I mean.
Sure.
You mentioned the MI word, and everybody gets a little shaky, you know.
Right, so the heart has three major arteries. There's little squiggly lines on this model, and when the blood flow is stopped due to a blood clot or
you mean clotting of one of these arteries?
Clotting of these arteries,
okay.
Or too much plaque or calcium buildup, and on top of it, a little blood clot is formed, and all of a sudden the blood flow is stopped.
Right.
There's no blood going forward. That muscle gets damaged. But within those muscles are those fibers that we talked about that those fibers that we talked about that carry the electrical signals.
Right.
So as those muscles die, messages cannot get through, therefore bad things happen to our fibers of the heart.
Okay. We only got a few more minutes. I want to get this in. Is gender a factor? More males than females? More females than males?
Generally not. No.
Not really. And what about race? Are there certain races that, hey, he came in and just because of that race, I know he's going to get a pacemaker pretty soon?
Very unusual.
Unusual.
Unlikely.
Okay. All righty. Tell me about some of the tests that you use to assess the heart. Like, what's a Holter monitor?
It's an excellent question. So patients come in, they say, I don't feel good, I keep passing out, I'm dizzy, there's something wrong, I'm sluggish. But when in the office, everything checks out. But we can't just let them go. What we do, we give them a little bit portable monitor, like a little beeper monitor, as a little couple wires goes through the chest, and it records their heartbeat for either 24 hours or 48 hours, sometimes even for a week, depends on the type of the monitor. And then maybe we can catch these things that come and go. Maybe on Monday you're perfect, but Tuesday you're bad.
Right.
So it will catch that, and we can help them.
Right. And as far as things like, just quickly, an echocardiogram?
Right. So then when echocardiogram is an ultrasound that looks at the function
like
of the heart.
Sonogram.
Sonogram,
yeah,
exactly.
sonogram that you put the jelly on and it shows you a picture of the heart contracting and stuff like that.
Does the beat good? How are the valves? How the function? Is it enlarged? Is it not enlarged? So it's a lot of information to help the doctor decide how the overall function of the heart is.
Right. Now, are there other diseases that if I have a pacemaker or anything that may be associated with, you understand, like for instance, diabetes or something like that? Are those patients more likely in the future to say they're going to need a pacemaker? Are there any diseases that you really have to say, I've got to get this under control, or it's really going to affect the way the heart functions?
Sure. So not necessarily directing the heartbeat, but because it indirectly may affect the vessel
Okay.
nature, the clogged arteries, the function of the heartbeat. For that very important reason, as you mentioned, the diabetes and blood pressure should be controlled. So indirectly it doesn't affect the heartbeat through different mechanisms.
Okay, all righty. And we did talk about, all right, let's talk about, I've had the surgery. Are there any post-surgery risk? All right, you know what I mean, things that we should watch out for. I know anytime you used to go to surgery, you think about infections and stuff like that, but are there anything that we really should watch out for?
Sure, very quickly, during the procedure, there can be damage to the vessel, there can be sometimes damage to the lungs, but if generally things go well, you have to make sure there's no infection on the incision. You have to make sure that you don't move too fast, you don't dislodge it. They can be monitored at home. They give you special machines that you take home. And then every now and depending on the instructions, you follow it, and you communicate with your doctor about how well the machine works, or pacemaker works.
All righty. And I just wanted, last thing, I know with pacemakers, there are certain things you can't come near. Like, I always hear about the microwave. Now, don't get near the microwave, you got the pacemaker. Tell me about that. What's the deal with that real quick?
So very quickly, the old microwaves, many decades ago, so they're not compatible for pacemakers.
Okay.
But the newer microwaves are generally fine. You want to make sure that you don't go with, especially in the airport, if you go to the airport, you show them your card. And then they use the wand to not interfere with the pacemaker. Okay. So that's important.
We're going to have to wrap up. Dr. Mahdi, thank you very much.
Omar.
It
was
so good.
Thank you.
I'm just loving it, the way you explained that. Okay, in closing, all righty, remember, sharing and caring. Hey, listen, do something special for somebody out there. And you know why? Just because you can. I mean, we need to go out and share our goodness with everybody else so that we can make this world just a little bit better for others. All righty. And remember, never institute any change in your medical care until you consult your physician. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.